Good morning, guys. We are group number 4. We're going to discuss that the bill 85 is about the acute recovery center. The bill is going to create the license to the acute recovery center. You just need to admit and discharge the patient in 72 hours.
First of all, we need to define what the bill defines as recovery care centers. The bill defines recovery care services as post-surgical and post-diagnostic medical and general nursing care to patients for whom acute hospitalization is not required and a recovery and total recovery is expected. Also can qualify for post-surgical recovery. The bill requires all patients to be certified as medically stable by their attending physicians and prior to the procedure and admission to the recovery care centers. A patient may receive recovery upon discharge from acute surgical care or after discharge from hospital. This revolutionary type of care was introduced and designated by Heather Fitzenhager in 2015. After that, the introduction of this policy, it failed. And then it's supposed to come back to the Senate in 2016 by the bill die in returning message.
And outpatient surgery are divided in two main branches, which is hospital outpatient surgery and also ambulatory surgical centers. In 2014, there were 2,009,033 and 87 persons that perform outpatient surgeries. With this amount of persons, the insurance were charged with 46% for the hospital outpatient surgery and 54% for the acute surgical centers, with a total amount of $33.8 billion. With this amount of money, the 77% belong to the hospitals outpatient surgery and the 23% belong to the ambulatory surgical centers, which is at the end we can conclude or realize that with the implementation of the bill of the 85, it's beneficial for the patients and also for the government, as I would say that, because they got money and they reduce the cost of the Medicare, and also with the implementation of that bill, they reduce the readmission of the patient in the hospitals.
Yes, as Giovanni said, it's very important to knowledge about which is the cost of the care of the patient in the outpatient surgery and in the hospital. Everybody knows how much is the cost of the patient in the hospital, and this law, when we try to pass this law, there is a lot of people to beneficiary with the law, like a nurse, like a patient, like a hospital, and a complete setting of healthcare. For example, it's going to be decrease the readmission of the patient in the hospital and increase the quality of care and improve the management of the patient in the outpatient surgery center in order to facilitate or avoid complication of this setting. This law is going to be implemented in order to improve the quality of care of the patient and decrease the cost of the Medicare of the patient in order to readmit in the hospital.